Hi, my name is Randall Loy. You've reached me on the Infertility channel. Thanks so much for joining me today. We're going to be talking about a little bit of an unusual topic for us. We're going to be talking about informed consent. In other words, do you really know what you're getting into? A few years ago, I had an attorney and his wife who came in for IVF, and we gave them the IVF consent form. This attorney brought back the document pretty much redlined out. He didn't agree with most of what was in there. He said, do you want me to rewrite the contract or do you want to rewrite it? And we submitted that it was a pretty boilerplate, pretty generic IVF contract, and if he was not going to consent to the risks, then maybe he needed to find an alternative. And ultimately, he and his wife did sign the contract. So I want to emphasize today that the informed consent is really not a document per se. It is a highly personalized process between you and your physician. The entire informed consent process is based on a few tenets of medical ethics. Now, medical ethics has their pillars. Number one, autonomy. One is free to pursue his or her own actions. Two is beneficence, goodness or kindness. Number three, justice, that we're going to treat you justly and fairly. Number four would be non-malfeasance, which means no misconduct. And number five would be veracity, which means truthfulness. So you should anticipate those things from your reproductive medicine specialist or any other medical professional. For any medical procedure, you should be informed of the indications. In other words, why are you doing this? What do you have as a diagnosis that means you need to undergo such and such a procedure? So indications. Number two would be risks. What are the risks of, if we take in vitro fertilization, what are the risks for ovulation induction? Step one. Number two, what are the risks for removing the eggs? Number three, what are the risks for fertilization in the petri dish? And then what are the risks for the embryo transfer? So that's just one example. So number one, indication. Number two, risks. Number three, complications and side effects. And number four, treatment alternatives. Now, lastly, perhaps you should have a consultation with one of your physician staff members about costs. Not only financial costs, but also the mental health costs and the social costs. And we reviewed that in a recent episode. So there are certain costs that you need to talk about, but that's all part of the informed consent process. Now, with respect to our field, what sorts of things deserve an informed consent process? Well, certainly in vitro fertilization, that's usually a pretty thick consent form. But if you're going to freeze eggs or embryos, if you're going to freeze sperm, or if you're going to donate sperm or eggs, you need to have a consent form. Certainly if there's going to be any third-party reproduction, surrogacy arrangements, for example, you need to have well-documented contracts and consent forms from your healthcare provider. I would like to leave you with just another story about how personalized this should be. At our particular clinic, we offer what we call a group IVF seminar. On the second Wednesday of every month at 7 p.m., we know that we're going to be in a local civic center, and we have many couples who show up, no name tags, no personal stories, and we ask at the end of the session, it's just an informed consent, it's a medical legal discussion, so we ask at the end of the session, are there any general questions? Please, no personal questions. We will continue the personalized touch in the office. Well, a couple of years ago, I was speaking, and I said, please again, no personal questions. And immediately to my right on the first row, and the room had about 100 plus people in it, 50 plus couples, and this woman shot her hand up immediately. And she goes, I've got a question. I said, well, yes, ma'am, what is it? She said, I know you've been talking about all this consent form stuff, but I have a question that does regard the consent form, sort of. And I said, okay. She says, well, my husband needs Viagra, and I was wondering, he has real bad erectile dysfunction, and I was wondering if in the IVF cycle, if we could still use Viagra. And the poor guy, he had a New York Yankees baseball cap on, and he slumped down in the seat like this, and he didn't leave his chair until the lights were out and the custodian was asking for his chair. I think they must have come in separate vehicles because they definitely did not go home together. Anyway, that's just another one of these stories from our practice, 30 years of stories. And I thank you for listening to these stories. I thank you for considering the informed consent process. It's very important to your well-being. Anyway, see you back next week here on the Infertility channel. Be sure to share this video with your friends and subscribe to catch all new episodes each week here on the Infertility channel. Plus, follow us on Facebook and Twitter. I love hearing from you. Comment below or tell me what you want to see on future episodes by sending me an email to comments@infertilitychannel.org. Until next week,